Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And on today's episode of Skin School, we're gonna talk about a very important distinction between hyperpigmentation and melasma. And why that's so important is because if you don't know which one of these you have, it could have major negative effects on the type of treatments and the type of approach that you take with your skin. In fact, melasma and not knowing it and doing certain types of procedures can actually worsen it. So it is very, very important for you to understand this distinction. I'm gonna help you understand it and learn a little bit about it so you can avoid some of these problems, but also be in a position where you can advocate for yourself and make sure that your providers understand what needs to be done in your particular case. All right, so without further ado, let's break it down. So what is skin pigment in general? Both melasma and hyperpigmentation, their common denominator is that there's an overproduction of pigment that comes into the surface of the skin and therefore is visible, right? So the source of it all is the melanocyte, which is the cell that creates melanin. Now, what happens is in certain conditions, the melanocyte ends up becoming overly stimulated and as a result ends up creating problems related to discoloration and pigmentation on the surface of the skin because all this melanin is floating up through the dermis and up into the top of the epidermis, which is the top layer of the skin, and then resting there. So, what are the things that stimulate the melanocyte in hyperpigmentation, and what are the things that stimulate melanocytes with melasma? So let's start with hyperpigmentation. Hyperpigmentation in the standard form comes in a few different varieties. One is post-inflammatory hyperpigmentation. You could have hyperpigmentation related to sun exposure. And you could also have hyperpigmentation related to injury. And let's talk about the most common type. So when you are out and about in the sun and you're exposed to UVA and UVB sunlight, what ends up happening is the UVA penetrates deeper into the cell and it goes down to the level of the melanocyte and it stimulates the melanocyte to create melanin. Melanin then moves on the way up, boom, you end up getting these sunspots along the surface of the skin. So the stimulant in that case is the sun. And as long as the skin is getting exposed to sunlight, it's producing more and more melanin and therefore more and more sun damage and sunspots. That's the idea between hyperpigmentation that's related to this sun exposure. There's another condition which I would say injury and inflammation are basically a continuation, but let's say you have an acne scar or you have a surgical scar and you pick at the acne scar or just the inflammation alone from the acne scar. That causes prolonged inflammation, like it's red for a period of time. Then the consequence in certain skin types, in darker skin especially, you have some hyperpigmentation that develops. We've all seen that. It's like a dark spot where the acne scar used to be, or where you get scratched or cut, there's a dark spot there. That's post-inflammatory hyperpigmentation. It can also happen as a result of chemical peels and lasers and things like that. So hyperpigmentation from those sources can be caused by inflammation and therefore fall into the post-inflammatory hyperpigmentation. I'm going to explain in a second why that's really, really important to understand. In that broad case that I just mentioned, it's the inflammation that's stimulating the melanocyte to create more melanin. In the case of sun exposure, it's the UVA light. So now let's switch gears into melasma. Sometimes melasma can be difficult to distinguish between hyperpigmentation, but it's usually described as larger, more coalesced patches of either brownish gray kind of, it could be in your forehead, larger spots in the cheek, it could be in the nose, it could be on the lips. They're just not like little spots here and there. They're more like islands, larger islands. And why that's important for you to understand, and if you can't differentiate this yourself, you definitely want to see a professional dermatologist, etc. The good news is, in the case of inflammation, most cases of post-inflammatory hyperpigmentation can improve on their own. It just might take 3 to 6 months after the injury has happened. To speed it up along, sometimes you can use retinol, hydroquinone, Sometimes in the case, you can use some steroid. And of course, trying to get rid of the inflammation as soon as possible can really, really help with that. The other really important part of that category is if you are prone to hyperpigmentation, meaning that you have darker skin like I do, or any kind of olive tone skin, before you get a laser, before you get a chemical peel, you want to pre-treat your skin with things that are going to suppress the production of melanin at the level of the melanocyte. And one category of that is hydroquinone. And usually the protocols are, if you're going to get a laser or a chemical peel that is a little bit on the deeper side, you're going to do that for at least 6 to 12 weeks ahead of the treatment. Therefore, you suppress, and therefore you don't see post-inflammatory hyperpigmentation. So knowledge about that is very, very important to prevent that problem from occurring. In the cases of sunlight, it's a bigger problem because when you're young, your body naturally protects itself against a lot of this. So you can go out on vacation and get a lot of sun, and you end up with this beautiful golden looking tan. But as you get older, 30s, 40s, 50s, all that sun exposure that you've seen when you were younger ends up coming back as hyperpigmentation later on. And from that point forward, the more sun exposure you get, the more hyperpigmentation you get. So there, the fundamental issue is the sun. So what do you do in that case? Well, number one, if you want a speedy, quick approach with it, you're going to use an IPL or a BBL, which basically is a laser that the target for the laser is the pigmentation. So it absorbs the energy from the laser, and then it bursts the pigments and breaks it up. So you do a series of IPL or BBLs and you clarify your skin, and all of a sudden a lot of that discoloration is improved. However, your skin is going to continue to build up more pigmentation, and as a result, you're going to have issues with more pigment down the road. So it's not a cure for it, it's just a temporary treatment. And I want you to keep this in the back of your mind, because I've just said that lasers, whether they're resurfacing, which can then mow down all that pigment and literally remove it, like a chemical peel or a laser peel that literally just removes the top surfaces of the skin, which will include the pigment, or if you use an IPL or BBL to remove it, you're going to improve the skin, but it's going to be temporary. But it is a treatment and a very popular approach to pigmentation in the skin when it comes from sunlight. But I want to keep this in the back of your mind, because it is literally the exact opposite of the thing you want to do if you have melasma. So let's get back to that in a second. Let's finalize this story and set the tone for melasma in a second here. So one of the most important things to keep in mind when it comes to sun exposure and stimulation from that is you want to suppress the melanocytes. Suppression of the melanocytes means you're going to use topical products like retinol, vitamin C, niacinamide, and certain types of peptides that are going to basically decrease the production of melanin. Then if you want to take it to the next level, you're going to use botanical products that are also targeting the melanin production pathways, which will also suppress it. So you're putting 4 or 5 different types of topical agents that are going to suppress. But the beauty of suppression is that once they are removed, they don't come back, or they come back in very, very small amounts. So topical uses of anti-pigmentation is going to be the standard approach for both melasma as well as hyperpigmentation, because in both cases, the logical thing to do is just decrease pigment. The other commonality between the two is that sun exposure exacerbates both. So the basic thing, if you have any discoloration of the skin, the most simple thing you want to do is put on sunblock that has broad spectrum UVA and UVB, and I do a whole video on sun protection, so make sure you watch that. Then you want to use the topical daily suppressive actives that I just mentioned, all of which, just to make life easy for you, happen to be in the trifecta, which is the product that I developed to, basically it's anti-aging, and part of anti-aging is managing pigmentation. It has all the things that I just listed in there. If not, you get them separately, but bottom line is they are necessary to decrease the production. And what this comes down to, and the simple analogy is, in the fall, your leaves from your tree fall, you go in there and you clean it all up, more leaves, you're doing this on a weekly basis. That's how you treat it with lasers. You're just basically responding to, the pigment that's on the skin. You're responding to the leaves that have fallen on the ground. But if you could leave the leaves on the tree you wouldn't have to go in there and sweep them up with a laser or any other that type of thing. So that's the concept that is really, really important to understand as a maintenance and a management. That's the commonality between those two. That's a common denominator. So now let's switch gears into melasma. If you have melasma and you go get an IPL or a BBL, or if you get a regular type of laser to try to remove these pigment, you are going to be significantly regretful because it's going to worsen the situation dramatically. You're going to have significantly more and darker melasma as a result of the lasers you treated, whereas if you did it for sunspots, you actually be improving the condition. So you can see that using a chemical peel, using a laser, using IPL on melasma can be extremely dangerous from the point of view of worsening the situation. And just to give you perspective on this, my wife has melasma. I did a whole series of melasma videos in terms of best ways to treat it. And we have done mistakenly all these type of things that I'm just telling you about. We did, lasers and chemical peels and this and that and the other thing. And actually her melasma was never worse than it was during that period of time that we were doing all this. And unknowingly, I did all that thinking that it was gonna make it better. Now we know in general that that's not the ideal type of treatment. For melasma, medical treatment with topical agents, with sun protection, is the best approach without requiring any type of device or energy or any of that type of stuff. That's the key to understanding the two areas, because I've even had a case where I did a chemical peel as part of my surgery. I did a vertical restorer for the shape, and I did a chemical peel to help with the skin. And sure enough, afterwards, the patient, it was a this happened to me twice, believe it or not, had a very low level melasma that was hardly noticeable at the time of the procedure. But once I did the chemical peel on her, I flared up all the melasma, and she had dark patches of melasma all throughout her face. It took months of hydroquinone and suppressive treatments to try to bring it back down to a level that wasn't so bright and really visually very distracting. I felt terrible as a result of that, but it was, again, lessons learned, right? So now if I have even the slightest suspicion and I don't know clearly between the two, I will make sure we get second opinions or third opinions to understand the differences between them, or just simply opt out of doing any type of laser treatments and stick with the topicals. So that's really, really, really important for as a take-home message. But again, common denominator is very simple. You should be on something like the trifecta. There's nothing as comprehensive as the trifecta, but all those components on there, and sun protection, and recognize that if you're young enough to be watching this, you can completely avoid hyperpigmentation from forming. And if you happen to be suffering from melasma, if you do these things the right way, you can 100% minimize the amount of melasma and the darkening of it. And just to keep in mind, remember, going back to the videos that I've made before, if you want to check it out, recognize that there are causes of it that you may be able to change in your lifestyle. Like, for example, if you happen to be on birth control pills or hormone replacement therapy and you don't really need to be on it, if you get off of it, that could improve your melasma. Unfortunately, some of it's just genetic, some of it is going to be environmental as well, but bottom line is there may be some things you can do, and it's good to understand which one of them you have. And a dermatologist, a good one, should be able to differentiate the two. All right, folks, I hope this helped bring some clarity on the differences between hyperpigmentation and melasma and what you need to do about them, what pitfalls and what to avoid. If you do these things, trust me, you'll be way better off. I've learned the hard way. I'm passing this information along to you. Okay, so if you enjoyed this, make sure you hit like. If you like my channel or like these type of videos, make sure you subscribe. I produce one of these every single week. Also, in addition to this, follow my Karam MD journal, which is a newsletter that comes to you. So subscribe to that. You'll love the content on there as well. And if you have any questions, drop them in the comments below. That was my pleasure to share a topic that is very near and dear to my heart. Until next time, Dr. Amir Karam.